Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic is interesting. Tips against cardiac arrest. It is interesting and heartbreaking because so many people have suffered and died from this sudden cardiac arrest. And they are mainly male, very close to one, and you want to see how you can help. The knowledge acquired on the heart itself is that the heart usually can last a lifetime, but when compromised, it suffers certain kind of problems. So if we can avoid the risk factor, yes, but how do we monitor how we avoid the risk factor? Is one of the things that I want to expose so that it becomes a tip for you to see how the present situation of your heart, so that you can know that you are probably far from sudden cardiac arrest when these facts are known to you. Nevertheless, there are people who do not have conditions that underlying conditions that really all of a sudden will suffer sudden cardiac arrest, but they are very few. Majority of people who suffer sudden cardiac arrest are people who have underlying condition, mainly heart problems. So there are other risk factors predisposing to it, like diabetes and obesity, but regardless, I will try as much as possible to expose those parameters you can check the other that can give you a little confidence or give you that kind of mind that yes, I feel I have done the needful, I have fulfilled all righteousness. So let's move on into the slide section. But as usual, if you like my presentation, press the like button, subscribe, and the quality of production will continue to go higher and higher. The objective: to create the necessary awareness of how the laboratory could be of great help in monitoring and evaluating the risk factors value as a guide and a predictor to show the imminence or probability of sudden cardiac arrest. The introduction. Cardiac arrest is one of the most common causes of sudden death, and it is not common in children but adults. You find anyway that some adults young 24, 25 but not very common could have sudden cardiac arrest. The most common cause of cardiac arrest is an irregular heart rhythm called ventricular fibrillation or tachycardia. Rapid erratic heart signal cause the lower heart chambers to quiver uselessly instead of pumping blood. Certain heart conditions can make you more likely to have this type of heartbeat problems. Examples are the coronary heart disease, which is very common, commonly associated with it, arrhythmia, congenital heart disease, and cardiac arrest. There are other underlying conditions that are not the heart, but nevertheless, for now, let's accept this. Talking about underlying condition as predictors of cardiac arrest. Diabetes is an underlying condition in developed world. However, in a reversal of trend, the greatest increases in prevalence of diabetes and coronary artery disease are being observed in developing nations. An important consequence of this will be an increasing incidence of sudden cardiac death, coupled with the fact that a study conducted in UK found that incidence of sudden cardiac death was significantly higher in areas of socio-economic deprivation. You are talking of where poverty resides. Trigger of SEAs, that is, sudden cardiac arrest, are a dynamic event, often difficult to measure and quantify. So serious physical activity and emotional stress are triggers of sudden cardiac arrest. Yes, let's talk about the risk factors, or what we may likely call the predators of sudden cardiac death or arrest. Diabetes, it is a chronic disease that is classified as insulin dependent or non-insulin dependent. It could be genetic or could be as a result of excess calories intake that overwhelm the pancreas. However, if one can effectively control his or her sugar level, the complication of diabetes will not cascade into heart problems that could cause cardiac arrest. The laboratory assistant or test that could be done is the fasting blood sugar 2 hours postprandial, and also we know that blood pressure is a serious problem. So the clinician will always do the blood pressure to check in order to avoid the complications that arises from continuous high blood pressure. Furthermore, number 3, the cardiac arrest is an electrical problem. It is the electric signal from the sinoarterial node that is irregular, and we know that there can never be any electrical activity in vivo without electrolytes. So the lab test will normally go to check for the electrolyte, urea, creatinine, magnesium, so that all these electrolytes are in their normal values. Once there is a derangement or an imbalance of any sort, that could be corrected so that it will not at the end continue to be a problem. ECG is another one, very important to check for irregular ventricular fibrillation or tachycardia by subjecting the patient to even minor exercises as the patient is being tested with the ECG machine. Yes, the state of the heart should have been number 1. But regardless, there are cardiac marker tests that could be done to know the state of one's heart. The lab tests you do are BNP, CK, creatinine kinase, LDH, troponin, myoglobin, even the dimer test, where you want to check for pulmonary embolism. It's also a problem that could affect the electrical, the ventricular fibrillation. The normal values of beta type, the BNP, is less than 100 picograms per mil. BNP level goes up when the heart cannot pump the way it should. So once the heart is having that kind of problem, you have the BNP is a hormonal test, you start to get worried that yes, there's a need for you to do something. The clinician has to do something about that. CK, creatinine kinase range, is also listed. Increased condition in nearly all patients when injury, inflammation, necrosis of the heart or skeletal muscle takes place. At times, you want to think it's not that specific for the heart muscle because you are talking of skeletal muscle as well. But the point is that once you do these tests, there are certain conditions that when you compare it, that you have no skeletal muscle problem, or even if there is the need for correction. Good enough. Yeah, a troponin is specific for the heart muscles. A troponin test measures the level of troponin T or troponin high protein in the blood. These proteins are released when the heart muscles has been damaged, such as occurs with a heart attack. The more damage there is to the heart, the greater the amount of troponin T and I there will be in the blood. So that's even very important, more important than the creatinine kinase for checking that heart muscles. Coronary heart disease. The most common type of heart disease in cardiac arrest is often caused by cholesterol, So when we know that that is the case, is the usual case, then we need to do the lipid profile test, where the value of our cholesterols are also taken into consideration. Finally, we have come to the conclusion. The list of laboratory tests that are available is endless, but the important ones are what I have listed, which should help in monitoring and evaluating the state of one's heart as one grows in age, because sudden cardiac arrest is not common in children. As we grow, these values may change. The heart could dip, but if you take care of the heart by knowing these values, and then the clinician will always tell you what to do. There is no need for self-medication, but it is very necessary for us to know the state of our heart. It gives us confidence. If you like my presentation, press the like button, subscribe. There are so many videos on this my channel that are concentrated on health matters, so you can check more of these videos.